Dr. Salma Aziz, and today we're going to talk about the surgical management of a bunion. To recap, we talked about bunions as being conservatively treated as well as surgically treated, depending on the extent of the bunion deformity, how advanced it is, and the type of damage that the bunion has. So today we're going to focus on the bunion deformity that did not get treated early on and became a surgical bunion. When we're again looking at a bunion or a foot model, and we're looking at our big toe joint, as I indicated previously, the long bone and the big toe have shifted. And the way that the shift has occurred is the long bone is medially deviated, meaning closer to the midline of the body, and the big toe is going over closer to the toes. So our job is to make sure that we reestablish the proper alignment of this big toe and the long bone to prevent further cartilage damage and to allow for a pain-free foot for the patient. The type of surgery, when we're talking surgical treatment, the type of surgery depends primarily on how advanced the bunion is. We as physicians will assess that in our office by again using clinical exam as well as radiographic exam, which if once combined together give us the type of bunion, how advanced that bunion is, and therefore the proper type of surgical intervention that's required for it. If we were to surgically take a look at a bunion, a moderate bunion, one where the patient has pain, there is deviation of the long bone and the big toe, however there isn't any cartilage damage yet present, then the surgical option becomes more of a bony cut in the bone. We often refer to that as an osteotomy. Now, a bony cut in the bone, what does that allow us to do? It allows us to take a long bone, the long bone of the first toe, which is, as I said before, deviated. By making a specific cut in this bone, we're able to take this bone and shift it over underneath the big toe joint. By shifting it over, we have now reestablished straight alignment here, which then allows us to allow good motion of the big toe over this cartilage. Once we have this proper alignment, we confirm this alignment in the operating room with a X-ray machine, and then this is kept in that position by various types of hardware such as K-wires, plates, screws. This becomes a surgeon preference, and certain things offer certain advantages or disadvantages depending on the patient. But once we have that alignment, then the patient's postoperative recovery ends up being approximately 4 to 6 weeks in a surgery type of a shoe, and within 4 to 6 weeks after that, patients are able to get back to normal activity, including strenuous type of activity like going to the gym and running. Moving on to the next type of bunion, we talked about the one that we don't have cartilage damage. Well, looking at a bunion where there is cartilage damage is difficult because the extent of cartilage damage is often difficult to determine unless we've actually are looking in the joint. We have studies such as MRIs that can help us in this, but regardless, the real damage to cartilage is determined at the time of surgery when we're physically looking at this joint. So when we're looking at the articular surface of the big toe joint, we know that there is articulation here on the head of the long bone as well as the base of the toe. And mild to moderate damage can be, as I said earlier, helped by doing bone cuts. But anytime we're dealing with moderate to severe articular loss or damage, then we have to talk about either removal of this joint and replacement thereof with an artificial joint, as is shown on this little model, or where we stop the movement of that bad joint altogether. Those become the only two ways. So we take this big toe joint and make it so that it freezes. This is referred to as fusion. By freezing it, we're eliminating movement, and the movement was what was causing the patient pain. But not to get ahead of ourselves, let's start with total joint replacement. Well, Again, if a joint is damaged, we can reestablish that joint by putting an artificial joint in. Nowadays, we have a list of various types of joints that can be used depending on the patient's activity level, the type of bone that they have, and what their overall activity level is going to be after surgery. So when we're talking about a joint replacement, it is a surgery whereby we take the joint that we were given, completely remove it, both at the level of the head of the metatarsal, the long bone, and the toe. Those two are removed, and then we replace it with something artificial. In this particular little model, we have a titanium surface to the joint. Often we use plastic type of joints that allow mobility. Again, when we're talking about replacing the joint, we're not going to give the patient a functional joint, one like we had before. However, an artificial joint in the big toe does and will still allow bending of the toe so that we can have smooth walking from one step to the next, as we since this is the job of this big toe joint. Last, if we don't want to do total joint replacements or artificial joint replacements, we have the last resort option, as I mentioned earlier, of fusion. Again, what is a fusion? A fusion is one where the surface of the cartilage is removed, a section of bone is removed, and the two pieces of bone are glued together, if you will, so that there is no movement and they become one instead of being two bones originally. The recovery from a fusion tends to be a bit longer because we do have to allow the bones to completely become solid and not have any gapping or movement about them. Fusion is more of a end-all procedure. In other words, once the bone is fused, more often than not, we don't have to go back and do anything else to it. Whereas, going back to our total joints are artificial, and they do and can, with wear and tear, need to be replaced. So that's the one difference between the two last surgeries that I talked about. At any rate, the three types of surgeries that I discussed are the three most common surgeries that we utilize for bunion type of procedures. And again, early detection offers the best treatment choices because we don't have to go to the end-all procedure such as the fusion if we detect, diagnose, and treat bunions early on, and offer the best treatments for our patients that way. And that's all for today. Thank you.